Good morning. I'm Dr. Jacqueline Holt. I'm a breast imager and medical director of Delaware Imaging Network. And I would like to speak to you today about how we're using artificial intelligence in breast cancer screening and diagnosis at this time. So before we begin with the AI portion, what is our goal with all of this in screening and AI? And let's take a step back and realize that we want to decrease breast cancer deaths. We want to reduce the burden of morbidities associated with surgery and chemotherapy, and realizing that finding a breast cancer at its smallest size leads to reduction in mortality and allows for less aggressive therapy. So if a breast cancer is found early, the survival is 99% in stage 1. And even when there's a lymph node positive or regional disease, the survival rate approaches 90%. And it's not just the survivability, but the hope is to decrease the amount of surgery, such as lumpectomies instead of mastectomies, and less chemotherapy, or sometimes no chemotherapy at all is needed. So the challenges of reading screening mammograms are multiple. Cancers can present very subtly. They can bury themselves or be obscured by dense breast tissue. And also the number of images, especially since we went to uniformly using 3D mammograms or digital breast tomosynthesis. Sometimes there's 100 images embedded really in each view, which leads to a complexity of a lot for the radiologist to handle. Okay, so what's happening in the healthcare field is AI is growing at a rapid rate. No surprise. The reason that the 2023 bar looks relatively low is because that's just for the first half of that year. In the 2022 bar graph, RadNet Deep Health was one of these FDA-approved technologies for AI, and also approved for prostate and lung. This is the pivotal study that we submitted for FDA approval and for which the FDA granted the approval. And what this represents is radiologists from across the country, and we are blinded to them, were asked to participate. In this study, there were 9 generalists, which means that they read other studies besides just breast, or they spent less than half their time reading mammograms. And then 9 specialists, which means they spent 100% of, or 90 to 100% of their time interpreting just breast studies. So there were 240 mammograms, 120 were normal, 120 had cancers in them. It was an enriched study. The square boxes represent the generalist and the circles represent the specialists. And they read these studies first without AI, which is the blue, and then 3-4 months later, they came back and they read with the AI helping them, and every radiologist, generalists and specialists improved. And this was published just last month in the Journal of Radiology Artificial Intelligence, and the synopsis is both generalists and breast imaging specialists are all helped or enhanced by the AI. By using the AI, the generalist radiologist can perform at the specialist level. And to note is that the AI was trained on millions of images, 8,000 biopsy-proven cancers from diverse populations. And this is more cancers than any one radiologist can see in their entire career, even if they are 100% reading breast imaging studies. So going back, it used to seem so difficult to have something like this in the past, but we have now been able to use equations that can be trained, and it's much like how we use Siri or Alexa with face recognition. And just like AI can see a bird, a dog, a ball, a motorcycle, and also, along with this, is that we have more powerful computers. They can handle these huge amounts of data. And this, what has changed dramatically, this is a computer in 1960. It weighs more than a ton, and it only holds 5 megabytes of data, whereas we can carry a terabyte of storage in our pockets. So what has not changed is we are not switching. Doctors are not going to be computers. We are using this technology to help and augment humans work together, reading mammograms and finding more cancers. So there's multiple uses for AI in breast imaging. The simplest is data mining, which seems basic, but computers can really hold a lot of data. They know who's coming in, their age, their race, and if they're early or late for a mammogram, and we can use this for calling patients and getting them to stick with the screening program. Also, risk assessment is now done with patients' history, but in the future, pretty near future, I believe, it will be made more precise with an AI evaluation risk assessment, also based on the glandular tissue. It kind of looks at the complexity of the glandular tissue in the woman's breast, and it makes the risk score more precise. We use AI for density, and I think the importance of density has become well known, and we really want to get this exact with less variability. Also, QA and positioning, this cannot be underscored enough. One of the most important aspects of a mammogram is a good technique in positioning. Do they have enough anterior tissue? Did the technologist put enough posterior tissue? And what's the compression? And that can all be monitored with AI. Now, the star of the show is really AI using to help us read the mammogram for signs of cancer. So data mining, starting with that, improves outreach and communication for patients. This is our data collected on women's race and who gets mammograms. Along the bottom line is the compliance. It means when does a woman come in? And notice the dip. And we all remember what happened in early 2020. It was the pandemic, and our mammogram compliance, basically our screening mammograms went down to almost nil. But notice pre-pandemic, we were not using AI to help us with compliance and having women come in for their mammograms. And you can see the green line is white women, red line African American, and you see the separation between the green and the red line. And then after the pandemic, we initiated the AI during the pandemic, and there was a difference, and we really got rid of the disparity in care and screening between white and African American women, and it's very important. African American women are at-risk population. So this is a simple use, but a very important one. We also use AI for breast density reporting. You can see the sensitivity of mammography decreases significantly as the breast gets denser. It's harder to find the cancer. Women with dense breast tissue also have an increased risk for breast cancer. So it's important we get this right for a woman's risk assessment. The AI can also auto-populate in the report the exact density, and this helps us with efficiency. So we can use AI for triage, meaning we know where to look for the cancers, and also for the interpretation, where the AI will specifically put a box where it sees it as most suspicious. And we can increase our cancer detection rate, meaning we find more cancers, and we can also reduce recalls or the false alarms, and even reduce unnecessary biopsies. So how this works, this is a schematic of how the AI works. Imagine that each dot here is a screening mammogram. There are 5,000 dots. There's a typical rate of 5 cancers per every 1,000. So there are 25 cancers here scattered throughout the boxes. And the AI can then stratify this into high, which is annotated by red, orange, which is intermediate, and then yellow and green for low probability and very low probability for suspicion levels, respectively. Now, for work triage, you can see that most of the cancers are in the high suspicion levels, and there are very little in the minimal, and in this case, none in the very low probability. And in this validation data set, this translates into about 88% of cancers are assigned to the high and close to 0 in the minimal. And this is what we see on our screens when reading these studies. We have a mammogram, and the right breast in 2 views is marked. This is what we call the CC view, and this is the MLO view, and you can see the pectoralis muscle. And marked in high on both is a cancer that is being boxed out or pointed out, like pay attention to this the most. And in this way, it marks the most suspicious area, and we increase our cancer detection rate. We increase our sensitivity. And one of the limitations of the human eye is that we can scan an image, but AI can scan every pixel of that image and help the radiologist see or pay attention to what's most important. So AI, what we have done is we have a second read system. It's hard to have 2 radiologists looking at every mammogram. There really aren't enough radiologists in the country to be able to succeed in a program such as that. So what we are using is an AI-driven second reading, so that a woman gets her mammogram, a radiologist reads the mammogram, and then the AI assists on reading that mammogram. Then the AI checks the radiologist assessment. If the AI detects something suspicious, then a second reader will review this. And this is an example or several examples of mammograms where cancers were found that we otherwise wouldn't have seen in this year of screening. So on this mammogram, the AI puts a box on the very back part, and you can see how that would be the radiologist paying attention to glandular tissue. This is really where cancers usually live. So something at the edge of the image being pointed out is very helpful. And here there's just the white arrow on a 2D image, the 3D slice, and then when the patient gets called back, knowing that it's there, the technologist is able to pull more tissue, and this was a well-differentiated invasive ductal carcinoma. This is another way AI greatly assists the radiologist when cancers are very subtle. The AI boxed this area of the mammogram, and when you really blow this up and look at it very closely, almost on second look, you can kind of see these little wisps of tissue or spicules, and easy to pass over with this tiny amount, this being the only finding on the mammogram. And this was an invasive lobular carcinoma, and that's the way it's a less common type of breast cancer. And they grow along the glandular tissue, and they can be almost invisible. Another example of something similar to that is when there's a density on the mammogram. It's always been there, but it's just getting a little bit denser. And that's called developing asymmetry. And the AI pointed this out. So the patient was called back for the additional imaging. And the image to the right is a breast MRI, right and left breast. And you can see the cancer enhancing. And that was a poorly differentiated invasive ductal carcinoma with lymphatic invasion. So it was an important cancer to find at that time. And sometimes cancers, they start so tiny, and maybe they're only 3 millimeters, and you can see how the human eye, it's just at the resolution where it's seeable. And the AI put a box on this, and this was a tiny invasive ductal carcinoma. So with this system, and this is across the country, we've been able to find hundreds of cancers that wouldn't have been found without this 2 radiologists and the system that we put in place with the AI. And I know that seems like a lot, but it is. We're in the nation, we do 1.5 million mammograms a year, but it's still very important to us to find every cancer that is possibly seeable. And in one of our markets, we were also able to decrease our callbacks or false alarms using this system. And I will show you in a minute more details on how that was achieved. And you should know that it's not just the low-grade cancers that the AI is assisting us and finding. It's really all types of cancers, including the very aggressive and important ones that we really want to find early. So I think you'll be interested in this because this is a study that we did in just Delaware here, myself and my colleagues, and it was presented at the Society of Breast Imagers meeting last year in 2023. And using the system here, we have 8 sites. We do 40,000 screening mammograms a year. And that's the amount of cancers, 230 that we found, but then we were able to find 40 more using this combination of deep learning, AI, plus the human peer review system. And as you can see, this is every radiologist was helped. This is without the AI. And with the AI, the blue and the red again. And every radiologist was helped, some to greater degrees, just like what we saw in the FDA approval. Also, you want to try to avoid false alarms, because a false alarm means that a woman gets called back, but it turns out to not be a significant finding or a cancer. And that's important because a high recall rate is associated with higher medical cost and also patient anxiety. So in one of our other Northeast markets, not Delaware, you'll be happy to know we really keep our recall rates down in Delaware, the way we practice. But this is a Northeast practice that has 300 centers. And what was noticed that the cancer detection rate, the cancers are almost all in the high category, but the recall rate was a bit more diffuse, and there were unnecessary recalls, especially in that minimal and low, and to an extent in that intermediate. So the same system that we used for finding more cancers, we also used to lower the recall rate. And with the same or increased cancer detection rate, we lowered the recall rates in this area by using a second radiologist, usually one with the most experience. They do the second radiologist reading after the AI and the first radiologist, and then they get together, they discuss this, and they come up with what the right thing to do for the patient is. And we can avoid callbacks using this technique. And this is the results, that the recall rates were too high, 15.9%, and they really should be below 10. In Delaware, we're easily below 10, so we're doing good. But in this market, we were able to drop radiologist recall rates from over 10 to under 10. And that, I think I will stop there. I want to thank you for your time, and I am happy to answer any questions. Thank you.